Dear authorities of the Kingdom of the Netherlands, thank you for welcoming us in your beautiful country. Dear authorities of the United Nations, dear excellencies and delegates, good morning. Thank you for allowing me to share my country's experience and to represent my region. It's actually really interesting for me to represent my region, and I'll tell you why. My region is a, relatively speaking, young region. And as you can see, I am a young minister, and I represent a very young Ministry of Health. Ecuadorian Ministry of Health was the last Ministry of Health created in our region, so it's also a young institution. Last Friday, we were celebrating our 50th anniversary. So what's interesting is that youth and female gender are usually considered handicaps for being an authority at a national level. And I really think that youth has a lot of interesting qualities that have to be considered. The good thing about being young is that we are not afraid of making mistakes. And making mistakes is probably a very good way of learning. And learning from mistakes is probably the better way to innovate. I will be speaking to you about health because it's where I have some expertise. And I will be sharing with you a few of my country's experiences. And I really find interesting what the Ministry of the Interior said about redefining the role of the state. What we did in Ecuador was exactly that. We needed to redefine our role in order to comply with our constitution. After the arrival of our government, the Ecuadorian state has made remarkable progress in efficiency based on innovative proposals that in some cases have become an international reference. The 2008 Ecuadorian Constitution establishes that health is a right guaranteed by the state, which is directly related to the exercise of other rights, including the right to water, food, education, physical culture, work, social security, healthy environments, among others that support good living. In our process of restructuring the state, national policies with a universalist tendency were proposed, especially to the elimination of barriers allowing access to education and public health, seeking to universalize coverage. In the last 10 years, the Ecuadorian state developed a management model of high deconcentration and low decentralization. This model allows us approaching the management of services to the citizenship in order to achieve greater efficiency. In our commitment to guarantee the right to health, the Ministry of Public Health adopted this management model. This model allows approaching to the management of the services. I will mention a good example of how this innovative implementation had a positive impact on the health management at a very difficult crisis time. Perhaps the worst crisis our country has experienced in recent decades. It is important to note that in the last 10 years, the policy of developing a 5-year national plan for good living was established. This, focusing special attention to create and strengthen a centralized planning based on national objectives. In the case of health, the objectives of the National Plan for Good Living are mainly articulated with the third Sustainable Development Goal, which refers to ensuring a healthy life and promoting well-being for all ages. Aligned with the deconcentrated management model and to achieve the objectives of the National Plan for Good Living, the Ministry of Public Health has a comprehensive health care model that organizes the entire system, providing quality health services to the population at no cost. This model establishes that the primary care level is the main gate to the national health system, where 80% of the medical care is provided. The primary care level guarantees closeness to people and attention at lower cost for the system, where we are convinced that health services focused on the renewed primary healthcare strategy are prone to succeed. This comprehensive healthcare model organizes the network for health providers in the sense that the country has developed the integral public health network, which brings together the providers of the Ministry of Public Health and other health providers all together. This is a very good experience to show innovation because it redefined the role of public providers in order to achieve the right to health. It is because of this initiative that we are here in the Netherlands postulating to the prestigious United Nations Public Service Award 2017 in the category of innovation and excellence in the provision of health services. However, it is not the only health matter in which we have stood out. Ecuador became the first country in Latin America to accredit public hospitals internationally. It did this through Accreditation Canada International, which is a member of the prestigious International Society for Quality in Healthcare. In total, 40 public hospitals were accredited to meet international patient safety standards. Last year, the director of the Pan American Health Organization, Dr. Carice Etienne, recognized Ecuador for this achievement, among others. There are also other strategies that in terms of efficiency and innovation stand out in terms of health, such as the definition of types of establishments and many others that I would like to share with you today. Another important development of the country occurred with the implementation of telephone appointment scheduling in the health centers, for example, through a unique number at the national level. In 2016, 9,400,000 appointments were delivered to 730 establishments. In addition, the articulation of citizen assistance services through the ECU 911 system allows improving efficiency and effectiveness in responding to citizens in the face of emergency. The interconnection among the information systems of the state institutions, Ministry of Health, National Institute of Social Security, National Secretariat for Higher Education, Science and Technology, helps us to simplify procedures, to exercise better control, and to make better decisions based on reliable information. As a real example, as I said to you at the beginning, we can mention that Ecuador experienced an earthquake of 7.8 points on the Richter scale on April 16 of 2016. It was precisely in this context that the value of innovation made in the country was verified. This meant not only more efficiency, but greater effectiveness, and for sure, a proof of resilience. This is how the Ministry of Health, through its decentralized structure, was able to take care of the emergency since the first moments. Altogether, almost 5,000 attentions were registered in the first 3 days after the emergency. Our emergency management allowed that no person died or was injured in any of the hospitals during the earthquake of the evacuation process, although several hospitals collapsed and had to be evacuated. The integrated management of the health services through the integral public network allowed adequate and comprehensive health service provision with a full leadership of the Ministry of Public Health. Also, the deployment of international humanitarian aid was coordinated by the minister to guarantee the provision of health in accordance with the national needs. There are still new challenges every day. However, we are truly convinced that political commitment with sustainable financing will lead us to guarantee human universal rights and, of course, to accomplish the Sustainable Development Goals. Finally, I would like to say that this wouldn't have been possible without the international cooperation. Good experiences need to be shared, and that bad experiences too, as I said. We need to learn from our mistakes as well as from our good experiences. Spaces like this invite us to do that. Innovation is about changes, and today more than ever, we all need to be committed to change our future as public leaders. Thank you.